Hi, I'm Dr. Kevin Winthrop, a professor of infectious diseases and public health here in Portland, Oregon at the Oregon Health Science University. It's a pleasure to give you a brief teaser of a vaccine deck that Pfizer Medical Affairs and I recently put together that provides an overview of vaccination in patients with rheumatoid arthritis. In this deck, we cover several sections. First, we start off by showing differential infectious risk that's associated with RA in general, and then we focus on specific vaccine-preventable infections such as shingles and influenza. We then focus on vaccines of interest and the effects of DMARDs upon vaccination. I think this is where the rubber hits the road, frankly, for the rheumatologist in terms of understanding how their DMARDs that are being used in a particular patient may affect vaccine responses, and what they should be doing, importantly, about those DMARDs at the time of vaccination. Some of these DMARDs should in fact be held at the time of vaccination, and this presentation will go into current ACR guidance around this issue. There will be an overview of the following vaccines, and again, the ACR guidelines that were just recently published, including thoughts on influenza vaccines, SARS-CoV-2 or COVID vaccines, pneumococcal vaccination recommendations, shingles, and hepatitis B, and then some other vaccines of interest that are sprinkled in the deck. And just to show you one example, this is the updated guidance around pneumococcal vaccine. Of course, we have a new vaccine, the pneumococcal conjugate vaccine 20 or PCV20. We also have PCV15, and it can be confusing how to use these vaccines, but this deck is hopefully going to solve that confusion. Here's one example of the slide speaking to how to use the new pneumococcal vaccine. So in summary, I hope you'll enjoy the deck and its presentation. It's full of both the reasons to vaccinate, the types of vaccines to consider, and how to vaccinate, and particularly in light of the new ACR guidance.